is just whatever foot position you're comfortable in. Just come down into like a deep squat. Like, what does that look like for you? My screen now?
Yes.
Okay. So we're mainly looking just at the foot muscles here. So this is like if you just take the bottom of your foot and you take that skin layer off, and then kind of the fatty pad that's there. Right here is basically what we refer to as the intrinsic muscles in your foot. So what we're looking at is all those little muscles that are kind of between each bone and each toe. So like these are each toe, and then you have small bones here, and then each of these come through, and that's what curls your toes and flexes them. So this, for example, is the muscle on you that's a little weak, that's not wanting to let your toes and the other four toes kind of separate and do their own thing, weakness-wise. And for some of us, it's more just like a motor, like brain to muscle connection of that motor plan of we're not used to like ever doing that. So it's like if you worked on it for like a couple of days, you'd probably be like, oh yeah, now I can do it. But you've never necessarily had a reason to have to do it. But it helps to differentiate between like what our strength is and our overall control of those small muscles. And those are the ones that are going to give you stability of the foot. So they kind of play the most with like balance. So for example, climbing up a mountain, you don't have to be staring at your feet the entire way. Like you want to enjoy what you're doing and like get the big picture, you know, and not just be like, oh, I saw my boots for how many hours. So it's basically having that strength, and then that motor plan gives our brain the capacity to walk and move without needing to stare at what we're doing. It's the same as when you drive a car. You're not necessarily staring at the yellow and the white lines anymore once you learn how to drive. Like you make sure you stay in your lane and you naturally do it, but it's not like that intense focus as when you first start and you're like, okay, let me do this. So some of the things I want to do for you, and I'll check, I think there's like 2 other tests that I want to check out for you. But what I want to do is not only give you the mobility that you need at the soleus muscle. So let's see. Okay. Soleus muscle is one of your calf muscles. It's going to be, honestly, probably the most critical for you as far as in your climb that you want to train. Let's see. We'll look at this image and then we'll pull up a different. So if you're looking at the back of your calf, these 2 here, this is gastrocnemius. It comes above the knee. So like your knee is straight whenever it's working typically. And that's the one on males especially that you see like that calf muscle definition. Females, sometimes we get it, but not unless you're doing a whole lot of effort to try to like showcase them. Guys tend to get that muscle bulk there easier. For you, part of your tightness is in the tendon part of gastrocnemius. So you can see where the 2 heads come together. And then you've got this big tendon, and that's really what leads down here into your Achilles that you can see more here. So some of your tightness that you have is there. And then soleus, if you reflect this muscle back, lays underneath it. So you kind of see it on the sides of the legs. So that's why a lot of people say, like for soccer players, they have like wide calves. And it's actually just because their soleus muscle is really strong and developed. And that's what gives that image. Let's see. Let me get this one. So this is basically if you cut those 2 heads of gastrocnemius off and what you're looking at below. So soleus muscle is a really big, thick, meaty muscle. But the main thing to know is you're using that whenever your knees are bent. So running, it's always on because it's controlling your foot position so that your foot doesn't just like slap the ground. So it's doing that slow control. and gives you that control over it, essentially. So for you, as far as climbing Everest, when you're at that incline, your knees are going to be bent the majority of the climb as you're going up. So gastrock's not going to help you. It's going to be a soleus muscle that's doing like a huge bulk of the load for you.
That makes sense.
So not only stretching that muscle and making sure that there's not tightness coming from here is going to be key, as well as kind of working through any almost like adhesions and tightness within the tendon portion of gastrocnemius. But working this muscle in like an endurance way before you go is going to be really helpful too. And then I also want to include for you too, in one of our sessions, we can also get into a little bit of kind of the cardiac section of it. So I know we're working together mainly just for the ankle tightness, but I also want to give you not only for like altitude training, but also what's going to help is basically that percent of oxygen that's in your blood that's available for your muscles. That's key for not getting like the muscle cramps and for making it feel easy.